Good afternoon to Dicentra's fourth Natural Health Products Regulatory Update webinar of 2010. My name is Wilkie and I will be your presenter today. Dicentra is pleased to be able to present this webinar free of charge to stakeholders as part of our ongoing commitment to the education of industry and regulatory compliance. Dicentra is a one-stop shop for all your regulatory needs. From product concept to formulation to licensing and market access, we can help you. For more information, visit our website or call us or email us. As a test, the regulatory environment continues to evolve and change, and it's imperative that we all keep up to date on changes in policies, guidelines, procedures, and regulations in order to maintain our market access and competitive advantage. As we all know, compliance and enforcement is coming starting in March 2011. The objectives of today's webinar are to provide you with up-to-date information pertaining to the implementation and interpretation of the natural health products regulations in Canada, and also to provide you with other scientific and regulatory information that has relevance to the natural health products industry. Over the next 30 to 40 minutes, we'll talk about changes that have occurred in the last few months. These topics will include regulatory initiatives and associated policies, the status of applications quarterly report issued by the Natural Health Products Directorate, new guidance and tools for industry, product and ingredient information, emerging issues, activities of the Natural Health Products Directorate Program Advisory Committee, communications, and then a summary. Let's start with regulatory initiatives and associated policies. 2010. Excuse me, the talk of 2010 will most definitely be the creation and implementation of the Natural Health Products Unprocessed Product License Application Regulations, also known as UPLAR. We won't spend a lot of time on this topic as we've covered it in previous webinars, but suffice to say, it's important to how the industry moves forward. UPLAR is a voluntary system that will allow you to have legal products in the absence of a product license natural products number, excuse me. It is a voluntary system. You must self-identify and opt in within 60 days of your product becoming eligible for an exemption number. And this is important to know. It's up to you to identify yourself and apply for your exemption number. There are 8,074 exemption numbers that have been granted. The exemption number makes your product legal for sale, and this will be more and more important as we move into 2011. To be eligible for an exemption number, you must have submitted a complete product license application. It must still be in queue with the Natural Health Products Directorate. It must not meet any of the risk criteria, and it must have been with the Natural Health Products Directorate for 180 days from the date of the receipt of your acknowledgement letter and still not been issued a licensing decision. Your exemption number is your submission number preceded by the letters EN, and this number is not valid until it appears in the exempted products database. It's important to keep monitoring the exempted products database. In it, you'll find whether your exemption number is valid or whether it's not valid. That means your application has been refused, or whether it's licensed. The database is available to all stakeholders, to consumers, to health practitioners, and they will be checking it to see the status of your product. The status changes regularly. If your application is refused, you'll see pretty quickly that your exemption number is no longer valid. Again, reminder, you have 60 days from the date that you are eligible for an exemption number to opt in if you have not already preemptively opted into the exemption number. Give a significant number of product license applications that could qualify for an exemption number and that will be legal for sale on the market. The NHPD is prioritizing their review of these applications. As this is only a temporary measure, there is a sunset clause on UPLAR, which is February 2013. So it's to the Natural Health Products Directorate to get through their backlog of applications by that time. They are prioritizing the review of applications according to formulation, the number of ingredients, the complexity of the formulations, the claims that are being made, the strength of the claim, the significance of the claim, the types of ingredients that are being used, as well as the date that the product license application was received. Again, application management policy, we'll just talk about it briefly. It came into effect shortly after UPLAR. It applies to all applications received after that date. It's important to know the key components of the application management policy because it reflects the responsibilities of stakeholders as well as how the Natural Health Products Directorate will deal with applications as they receive them. So the key points are really that all ingredients, whether they be medicinal or non-medicinal in your formulation, must be in the Natural Health Products Ingredient Database before your application is filed. If they're not in the database, your application will be rejected. You need to have a complete quality submission when you first apply. No early or evidence IRNs are being issued. If you have all the components of a complete application, again, you will be refused. In terms of the performance targets, the NHPD has committed to attempting to adhere to the performance targets if your application is submitted electronically, and that's where the ePLA comes into play. Eventually, it will be the only accepted form of submitting your product license application. So now is a good time to get used to using the ePLA. Well, there's the opportunity to have pre-submission meetings with the Natural Health Products Directorate prior to submitting your application to ensure that you have all the required evidence and also that your product is actually a natural health product if that's in question. Again, another key component of the application management policy is the publication of proposed performance targets by the Natural Health Products Directorate. Again, the other component, in addition to the application management policy, is the revised Natural Health Products Compliance and Enforcement Policy. Again, this came into effect shortly after UPLAR and the application management policy. It is an all-encompassing compliance and enforcement policy. It no longer looks at just products. It looks at GMPs, claims, advertising, labeling, etc. Right now, we are in the promotion, the industry education and promotion phase. Come March 2011, we are expecting to have full implementation of the compliance and enforcement policy. There is some pushback currently within the industry. There are some associations that would like to see the compliance and enforcement policy postpone the implementation of this until we've seen revised standards of evidence and testing requirements, and those have been implemented. I would suggest that we should move forward assuming that full implementation or full enforcement will start in March of 2011. Again, compliance and enforcement will classify violations as to higher risk, may pose a risk or lower risk. So high risk violations would be things like unlicensed products, Schedule A claims, not meeting specifications. May pose a risk would be things such as GMP violations and false misleading claims, and those deemed to be lower risk would be things such as technical labeling violations. So again, mission numbers as we move forward, they are still a means of market access, but come March 2011, a submission number will not let you have access to the marketplace. So again, just to summarize, we will need to have a natural product number, DIN-HM or exemption number by March 1st, 2011. When we're preparing an application, we must make sure that all ingredients are in the database, which could take between 4 and 6 weeks. We need to determine if we're looking at performance targets, whether we're attesting to pre-cleared information or non-pre-cleared information as our evidence sources. The data should be submitted electronically and preferably using the electronic product license application form. So it's important as we move forward, we need to have those licenses on our products. We need to make sure that we understand the requirements for submitting an application so that it is not refused at the outset, so that we have a good opportunity for a full assessment of the product license application and that it will ultimately result in a product license. So just a summary of where we're at with submission numbers, exemption numbers, and natural product numbers. In terms of being legal for sale, they say the submission number currently is interpreted as an administrative tool. It's a tracking tool for you to identify your submission and find out where it is in the queue. It will currently allow you market access, but in March 2011, a submission number, again, is only an administrative tool. With an exempt number and a natural product number or a DIN-HM, your product is deemed to be legal for sale. With a submission number, you cannot advertise. With an exemption number and a natural product number, you can advertise. Just a couple of comments in terms of pre-clearance. Some broadcast and print media require advertisements to be pre-cleared. Advertising Standards Canada is one of the pre-clearance agencies. They have said that they will issue a clearance number for products with exemption numbers, that they will review the advertisements, and if they're in compliance, that they will issue a clearance number. However, that number is only good for 12 months. And if your product, if your exemption number becomes invalid, then that clearance number is no longer valid as well. So what they are asking for is a copy of your product license application and an attestation that that product license application submitted to Advertising Standards Canada is identical to the application that is on file with the Natural Health Products Directorate. On the other hand, the Pharmaceutical Advertising Board that reviews advertisements directed at health professionals, they do not pre-clear advertisements for products with ENs. Just because it's not a full license, it's a temporary measure. So any health materials directed towards healthcare professionals that need to be pre-cleared, the Pharmaceutical Advertising Board will not offer that service if you have only an exemption number. Eligible for an international trade certificate. If you have a submission number, you're not eligible. If you have an exemption number, you're not eligible. But again, if your product is fully licensed and has an NPN or DIN-HM, you are eligible for an international trade certificate if you need that for foreign market access. In terms of access information requests, again, if your product only has a submission number, you cannot, a competitor, for example, or another industry stakeholder cannot file an access to information request for that submission. Once you get your exemption number, though, you can be subject to an ATI request. Once your product is fully licensed, you are subject to ATI requests. The last one, the risk for compliance and enforcement action. After March 2011, if you are on the market with only a submission number, you are at high risk, very high risk for compliance action. Compliance and enforcement policy lays out the expectation that you should have either an exemption number or a natural product number come March 2011. So if you have an exemption number, the risk of compliance and enforcement action is fairly low unless there is a hazard identified with your product or if your exemption number becomes invalid. If you are a fully licensed product, the risk for compliance and enforcement action is very low. Again, unless a hazard is identified with your product after it's been evaluated and gone to market, again, the risk of compliance and enforcement action is very low. So next, I want to look at the status of applications quarterly report. This is issued quarterly by the Natural Health Products Directorate. They are operating on a fiscal year. Their year goes from April 1st to March 31st. So we are now in the looking at the second quarter results for the Natural Health Products Directorate. This report gives stakeholders an update on the activities that they've conducted in terms of product and site licensing and how successful they have been. So there's a bit of information in this most recent status of applications quarterly report. It covers the second quarter, which is from July 1st to September 30th of 2010. You can see the link there where you can find a copy of the report. Natural Health Products Directorate has changed the way they're reporting their product licensing statistics. Previously, it was based on how they were dealing with the applications in the backlog, those applications received prior to April 1st, 2008, versus the ones received after April 1st, 2008 were deemed to be the regular workload. So previously reporting was against backlog targets and regular workload targets. With the introduction of UPLAR, we're now looking at reporting against the status of those applications received before August 5th when UPLAR came into effect versus those received after. So we'll be at pre and post UPLAR applications in terms of reporting. So pre-UPLAR applications, we're basically looking at their review based on the priorities we discussed earlier. With the post-UPLAR applications, they will be evaluated based on the performance targets that the government has laid out in their application management policy. So again, we're no longer talking about backlog and regular workload. We're looking at pre- and post-UPLAR submissions, application submissions. Overall, at the end of September 30th of this year, the government had received just over 54,000 product license applications since they opened their doors for business January 1st, 2004. The numbers in brackets refer to the first quarter results, so you can compare between second and first quarter. During the second quarter, in total at the end of the second quarter, 44,000 plus assessments had been completed, so 81% of the applications received had been either licensed, refused, or withdrawn by the applicant. This translates into just over 24,000 product licenses have been issued, representing 32,000 products. Because on one product license, you can have different flavors, for example, or different brand names of the same formulation. Again, you can see the numbers are increasing. We continue to have new applications being submitted to the Natural Health Products Directorate. Also encouraging, as we've seen over most of the last quarters, is that there is constantly an increase in the number of companies that have received a product license. Hopefully this is an indication of new companies entering the Canadian market and of a competitive and growing natural health product sector. So if we look at the pre-UPLAR product license applications, prior to UPLAR coming into effect on August the 5th, the NHP was dealing with they don't like us to use the backlog, but over close to 11,000 applications were still within their domain pending licensing or refusal decisions. Then, since August 5th, 15% of those applications have been completed or in the process of being completed. As I mentioned, UPLAR is only a temporary solution. It does have a sunset clause of February 2013, at which time all exemption numbers, if they're still in the marketplace, will become invalid. So there is a commitment from the Natural Health Products Directorate to get those applications reviewed and a licensing decision rendered by February 2013. Of the categories or the types of applications within those pre-UPLAR submissions, the bulk are non-traditional applications. And historically, those have been the types of applications that have given the most trouble to the Natural Health Products Directorate in terms of trying to evaluate them. So close to 70% of those applications eligible for exemption numbers are non-traditional applications, followed by traditional applications at 16%, 10% are food-like NHPs, 5% homeopathic, 2% amendments, and 1% are TPD Category 4 labeling standards. Again, those 10,000 plus applications that were present prior to UPLAR coming into force, 75% of those are eligible for an EN. That means they don't have any of the risk criteria, the risk criteria being products that are for pregnant and nursing women, products for children under 12 years of age, oral ophthalmic products, products with Schedule A claims or with prohibited substances, or ones that contain a product that has been subject to a recall or contains a harmful substance. So those 75% are eligible for an exemption number. Within that 75%, 55% have already received an exemption number, 19% have not applied, and 1% have actively opted out. So those 19% that have not yet applied, either they just can't be bothered to apply, they're not aware that they have to self-identify and apply for an exemption number, or perhaps they still have 60 days for the date they've become eligible for an exemption number to apply, and they're waiting it out, or they're trying to come to some decision whether they really want to have an exemption number or not. Of the 20% of those applications that are not eligible for an exemption number, 7% possess a risk factor, as mentioned earlier, and 18% do not meet the 180-day criteria. So they're still waiting for their applications to have been with the Natural Health Products Directorate for 180 days since the receipt of their application acceptance letter. Again, hopefully at this slide you can see fairly clearly. This gives you the status of the applications and amendments that were received prior to August 5th. So these again are the pre-UPLAR applications that are with the Natural Health Products Directorate. So if we look at the first section, it talks about the products that have been licensed, that are in licensing, that have been refused, that are to be refused, and the ones that have been withdrawn. So these are the applications that have been dealt with since August 5th to the end of September. So that time period they had dealt with 1,600 of the 10,885 applications. So 1,602 applications that have been completed, you can see that one-third of them, 413, have been refused. Another 246 are about to be refused, and 157 have been withdrawn by the applicant. So that's more than half that have either been refused or withdrawn. So fighting this battle that almost every 1 in 2 applications is being refused. Look down further, you can see the ones that are in full assessment in progress, the number of applications with IRNs. But the other thing I really wanted to point out about this table, which is taken from the second quarter report, is just down near the bottom, halted pending internal decision related to safety or efficacy. There's 2,600, almost 2,600 applications that have been on hold or put on hold pending internal decision. So we'll later about some of the categories that are on hold right now, pending internal decisions by the Natural Health Products Directorate, but that's a significant number of applications that are on hold within the Natural Health Products Directorate. So again, you want to make sure before you're submitting an application that you don't end up in that black hole of one of the halted applications. If we move now into the post-UPLAR applications, this is the product license applications and amendments that have been received by the NHPD since August 5th when UPLAR came into force. So for these applications, the application management policy applies. So for example, the stringency, the requirements for a complete application have been increased, have been ramped up. You need to make sure that all your ingredients are in the database, and preferably if you want the government to try and adhere to the performance target, you've submitted your application electronically. So August 5th, 1,424 applications and amendments have been received by the Natural Health Products Directorate. Again, looking under the application management policy now in terms of whether your application meets pre-cleared information, so that would be compendial applications, labeling standards, and abbreviated labeling standards that are under the NHPD's jurisdiction. Application attests in its entirety to pre-cleared information, then the performance target is 60 days for a complete review and rendering of a licensing decision. So 40% of the applications that have been received since August 5th until the end of September met the pre-cleared information requirements in terms of meeting the performance target, the first one being 30 days for pre-screening of the application and ensuring that it's complete. The government has met that 30-day initial screening 100% of the time for compendial applications, 100% of the time for labeling standards, as well as for amendments. And again, with these types of applications, the government has been meeting their performance targets fairly regularly for the last little while. One thing with the performance targets, again, they are not legally binding requirements with the exception of compendial applications, and then there is the 60-day disposition clause that is part of the Natural Health Products regulations. So with the exception of compendial applications, the others are just performance targets. They are not legally binding. Again, some further information about the post-UPLAR applications. The other 60% of those applications require a full assessment, so they're not attesting to pre-cleared information. The performance target for non-pre-cleared information applications is 180 days. plus there is another 30 days in there if there is an IRN request and you need to respond to it. So the clock stops for those 30 days when the IRN request goes out and the applicant has time to respond. So with those applications, there have been application acceptance letters issued for 328 of those applications, and within 97% of the time, those application acceptance letters have been sent out within the performance target of 30 days. These applications, there's been 9 product licenses issued. 194 products have been issued a notice of refusal. And again, this is at the outset of the evaluation. These are products that haven't even made it into the evaluation step. They've been refused at the door of the Natural Health Products Directorate. And again, have been withdrawn by the company. All within this, these numbers, the ones of the 328 where an application acceptance letter has been issued, again, 44 of those applications have been halted, again, pending an internal decision related to safety or efficacy. So we need to have a good understanding of which types of applications are being put aside until decisions are made by the Natural Health Products Directorate. And again, since we've just started into this and the government is just starting to report on pre and post UPLAR applications, there is limited data, but you can see that they are moving in the right direction in terms of meeting their performance targets. Again, this is just an overview of the performance targets that the government has set out for themselves. Again, keep in mind that it is only the compendial requirement that is legally binding. The others are proposed performance targets. The 60 days is the target for applications attesting to pre-cleared information, and for those not attesting to pre-cleared information, it's 180 days, but there's also 30 days added on that if there is an IRN that's issued. And to date, I don't think we've seen any applications where there's not been at least one IRN issued. With the exemption number, you're eligible for an exemption number 180 days after you receive your application acceptance letter. So typically it's 30 days to get your application acceptance letter, and then another 180 days before you're eligible for your exemption number. Some other information from the Status of Applications Quarterly Report. Again, this is specific to the second quarter now, from July 1st to September 30th. Within the time frame, the government completed 2,874 product license applications. Completed means licensed, refused, or they were withdrawn. You see that 56% of those applications received licenses. So again, here we are with this sort of 50-50 licensed versus refused or withdrawn. So 36% of the product license applications were refused and 8% were withdrawn. So again, you can see numbers in brackets refer to the first quarter of their fiscal year from April 1st to June 30th, and then the first numbers are the second quarter. So they completed approximately 800 less applications in the second quarter than the first quarter. They've definitely issued less licenses and refused more licenses compared to the first quarter, and the number of product license applications withdrawn by the applicant is roughly the same. Look at the 2,000 applications that were refused during the second quarter. The main reasons were as follows, and again, referencing the first quarter numbers in brackets there. So the bulk of the refusals were because the applications failed to meet the basic requirements. So the submissions were not complete, and these 49% of applications were refused at the door during the initial review process. They only got when the first reading of their application and something was missing. So again, this speaks to the increased rigidity of the screening process that the NHPD has adopted under the application management policy. You really need to make sure you have a complete, high-quality submission, or you're going to get refused right at the door. So this is slightly less from first quarter. So hopefully it's on the right track, and fewer applications will be refused because they failed to meet basic application requirements. Again, 35% were refused when the applicant's response to a request for further information did not meet the requirements. 5% were refused when applicants did not respond to a request for further information. So interesting, it seems like applicants are responding more from the first quarter to NHPD requests, but they're not providing the right information. So the numbers are reversing. They're responding more, but with not appropriate information. Some of the other reasons the applications were refused, these are fairly insignificant in the scheme of things. 2% of applications were refused because the ingredient was not in the ingredient database. And again, this is part of the application management policy now. You have to make sure all your medicinal ingredients and non-medicinal ingredients are in the database before your application is filed. 1% did not meet the definition of a natural health product, which is encouraging. This number has been consistently around 1%, so I think we have a much better understanding of what's a natural health product versus what's a food or a cosmetic. 1% of applications were refused when quality, safety, and or efficacy issues were identified. So again, this number has decreased from the first quarter. So again, just underscores the importance of understanding the requirements for a complete high-quality submission. Look at the types of applications that were submitted during the second quarter. The bulk of applications, again, were non-traditional applications. So this is the same thing that we saw pre-UPLAR. Non-traditional formed the bulk of the application type, followed by compendial, then traditional, homeopathic, TPD Category 4 labeling standards, and NHPD labeling standards. So again, the bulk of applications being in the non-traditional area. And again, numbers in brackets, or the second number, pardon me, refers to the number of applications in the first quarter. Just briefly, some data. This is overall data on site license applications coming from January 1st, 2004, when the regulations were implemented, until the end of September. 1,600 approximately applications for site licenses have been received since January 1st, 2004. 96% of those applications have been completed, so they've either been issued a site license, refused a site license, or they've been withdrawn by the applicant. 1,070 licenses have been issued. They're looking at close to 2,000 renewals having been received, and 95% of those renewals have been completed. So historically, the site license process has been more efficient and effective than the product licensing. They seem to have been able to stay on top of their numbers really well. Comment here, though, you can see that 1,070 licenses have been issued since the beginning, but that still leaves 534 applications that were refused or withdrawn. So at first glance, these numbers look better than the product licensing side, but still approximately 30% of applications have been refused or withdrawn on the site license side, versus 50% in the product license side. So move away from the status of applications report. Now we'll start looking at some of the new guidance and tools for industry that have come out in the last few months. At this point in time, I'd just like to request that you have a look at the side there. There is a link in the chat box that will take you to a survey. We'd appreciate it if you would complete that survey before the end of the webinar. It's important to have your input as to how we can improve this tool for your use. So again, if you would please go to the link at the side before the end of the webinar and complete the survey. It would be greatly appreciated. Some new documents that has come out. This came out in October of 2010. It's effective as of October 26, 2010. It's a revised guidance document for Schedule A claims. This is a revision of the 2003 document. It's been changed to incorporate regulatory amendments that were passed in June of 2008, which allowed over-the-counter drugs and natural health products to make preventative and risk reduction claims for Schedule A diseases. So the regulatory amendment in 2008, again, it exempted natural health products from the prohibition on making preventative claims for Schedule A diseases. So again, just to regroup, Schedule A claims are those, Schedule A diseases, pardon me, are those that require practitioner intervention. So historically, there has been a prohibition on the the advertising, labeling and advertising of products with Schedule A claims for consumers. This applies to foods, cosmetics, drugs, medical devices, natural health products. So the exemption is only granted for over-the-counter drugs and natural health products, and only for preventative and risk reduction claims. So the revised guidance document speaks to those amendments and provides information on the type of evidence that is required to be submitted to support a Schedule A preventative claim for a natural health product and for an over-the-counter drug. So you can see where you can find this guidance document, and effective as of October 26, 2010. A companion document to that is a fact sheet on Schedule A health claims for natural health products. Again, this was updated November 2010, and this is in response to the updated guidance document. So again, you'll find information here more specific to natural health products and how the guidance document pertains to it. And this is a fact sheet that has been in place since May of 2007 regarding Schedule A health claims for natural health products. So we talked earlier about the importance of the electronic product license application, how eventually it will be the only form accepted by the Natural Health Products Directorate. A new version of the EPLA was released in November. We're using version 1.4.1 currently. There were some issues with the previous version with the export feature. So this has been corrected on this new version. The export feature is important as the NHPD continues to upgrade their EPLAs. The export feature will allow you to migrate your data from one version of the form to the next version of the form without having to manually re-enter it. So it's recommended that you download and use the latest version of the EPLA, which is 1.4.1 right now, so that you use that for any new applications and for moving forward. Again, instructions for using the export feature are going to be provided with the next planned release. So already the NHPD is anticipating a modified release, a new version of the EPLA sometime this month. And again, the export feature is only available starting with version 1.4.1. So again, it's good to familiarize yourself with the EPLA, specifically with the new version, get familiar with it. If you need more information, you can go to the Natural Health Products Online Solutions section on their website. And if you have specific questions, you can send them to NHP_initiative_PSN at HC-SC.GC.CA. Another form that was recently updated, we're now on version 2 of the ingredient database issue form. Again, as mentioned previously, you need to have all your ingredients in the database before you submit your application. So if you need to add an ingredient, whether it's medicinal or non-medicinal to the ingredient database, or whether you need to change some of the terminology within an entry, you must use the specific ingredient issue form. If you don't use the issue form to make your request, it will be refused. So this new version has fewer steps to complete, and it helps ensure that all the necessary information is supplied to the Natural Health Products Directorate. And you need this form. You must make your request on the ingredient issue form, or it will not be processed. You can see the links there. One is for the actual ingredient issue form to submit your request for changes, and the other is a companion guidance document, the Natural Health Products Ingredient Database Issue Form Guide. And you can see the specific email address if you have questions about the ingredient database or the ingredient issue form. Please send them to ingredient_support at HC-SC.GC.CA. Moving on, looking at product and ingredient information. We talked earlier, there's a significant number of applications that are on hold within the NHPD pending internal discussions and decisions. One categories of products that we are aware of, weight loss and weight management products, are currently on hold. We are expecting guidance to come from the Natural Health Products Directorate. There has been a working group convened to specifically look at these products and issues associated with them. So hopefully in the near future, we will see some kind of guidance document or monograph come out to deal with weight loss, weight management products, but in the meantime, they are on hold. So it's recommended to submit an application at this point in time with a claim specific to weight loss, weight management. If you have other claims on your product, and this is a companion claim, that might be one thing, but not recommended to submit a product with only one claim for weight loss, weight management. Along with this, we do expect to see revisions to the monographs for 5-HTP and green tea because they do allow currently weight loss, weight maintenance claims. So we expect to see these revised as well when the guidance comes out on weight loss, weight management products. Enzyme-containing products, these applications again have been on hold for a fairly long time. There is a labeling standard published, though, specifically for lactase from Aspergillus flavus, but the applications are on hold, and probiotics are also on hold. So it's important to know where the government is with some of these product categories so you don't get stuck, again, as I mentioned previously, in a black hole. The other that is going on is that the NHPD is changing its acceptable limits, its specifications for dioxins in fish oils. So applications for fish oils, that with the Natural Health Products Directorate, they have been pulled out of the assessment queue and are being reevaluated under the new standards. So fish oil products that have been issued a license, you'll probably be seeing a Section 16 notice shortly saying you need to revise your specifications to the new standards. For the products that are under review currently, they'll probably be issuing IRNs, again, to update your specifications with the new tolerances. Left is a listing of ingredients that are available to the public only via prescription. Canada made a commitment to review the list of Schedule F ingredients, specifically looking at natural sourced ingredients that could be classified as natural health products. The review looked at reasons why to prioritize number one, these ingredients for review, to look at the reasons why they were put on Schedule F initially and to see whether they should remain on Schedule F moving forward. There were two regulatory amendments proposed, two different schedules. One listing of 4 ingredients that would be removed in totality from Schedule F, so they would be allowed for over-the-counter use, restricted use. Appiol oil, Centella asiatica extract and its active principles, dianol in its salts and derivatives, and theobromine in its salts. So that schedule is proceeding. We're hoping to see final publication in Canada Gazette Part 2 in early January, February of 2011. So once that's published in Canada Gazette Part 2, those ingredients would be available for industry to use as natural health products, either ingredients or finished products. On the schedule, there were 6 ingredients. They were proposed that should remain on Schedule F, but with qualifiers that would allow for some over-the-counter use. So those ingredients were dopamine, gold, uracil, dimethyl sulfoxide, levocarnitine, and L-tryptophan. Again, this schedule is moving forward, and we're hoping to see final regulations published in February, March of 2011. So again, some uses, some indications, some dosages of these ingredients would remain on Schedule F as prescription drugs, but there would be other indications or dosages, for example, that would be allowed for over-the-counter use. The other ingredient that was part of this prioritized review was lovastatin. It was coming from red rice yeast. It's been pulled out and is moving forward as a standalone package. There was a significant number of comments received on lovastatin and probably a variety of views that were being put forward. So it's been pulled out of the other packages. It's under discussion within Health Canada, and it will be hopefully moving forward, but at a slower pace than the other ingredients. Just to follow up to energy beverages, there was a letter submitted to applicants of energy beverages back in June 2010. This letter was requesting information on adverse events that had been reported regarding the consumption of energy beverages. This was submitted by stakeholders to Health Canada, and now we're reviewing this in light of any of safety issues that have been reported associated with the consumption of energy beverages. So they are convening a scientific expert panel to look at appropriate risk management strategies for energy beverages. So again, this is the result of adverse events being reported within the marketplace, both in Canada and internationally. Information was requested from stakeholders. It was submitted up until October 12th, and now it's under review by Health Canada and their scientific panel to come up with strategies on how to mitigate any identified risks. In terms of emerging issues, one is view of calcium supplements. There was an information update, again, posted in October, informing Canadians that Health Canada was conducting an ongoing review of the risks and benefits associated with calcium supplements. This was the result of public interest and media reports sparked by the release of a study in the British Medical Journal that identified a potential link between the use of supplements without supplementary vitamin D and an increased risk of cardiovascular events in patients with at a risk of osteoporosis. Health Canada reviewed the study and determined that it did not demonstrate a conclusive association between calcium supplementation and cardiovascular risk. However, Health Canada is continuing to monitor the information and evidence that comes forward. The dietary reference intakes that are used to develop acceptable calcium intake recommendations are currently under review by the Institute of Medicine. So the dietary reference intakes we base our acceptable daily intakes and recommended intakes of various vitamins and minerals against. So the one specific to calcium is being evaluated at this point in time. And the bottom line is that Health Canada did not find any conclusive link between the use of supplements and cardiovascular risk in this study. The other thing that's happening is an increased emphasis on allergen labeling with natural health products, specifically with probiotic products. There was a Section 16 notice out to holders of holders of licenses for probiotic products, asking them to verify that their products had not come into contact with any of the priority allergens. This is based on proposed amendments to labeling of allergens on the food side. So it's kind of interesting that the Natural Health Products Directorate is piggybacking onto proposed food regulations. So the Section 16 notice requested that the applicant review their manufacturing procedures and ensure that the product did not come in contact with a priority food allergen, and if it did, then they were asked to put risk information on their product labels. So if it either were to submit an attestation confirming that there was no contact with a priority food allergen, and if there was contact as part of one of the ingredients or cross-contamination, then the following risk information: this product has come into contact with X allergen, whether it's milk or nuts or sesame seeds, for example. This product has come into contact with a specific allergen. Do not use this product if you have, for example, a milk allergy. So that information has to go on the label. It's not acceptable to say a product may have come in contact with or may contain a potential allergen. You must specifically identify the allergen that your product has come in contact with. So industry that received these Section 16 notices had 15 days to respond to the government and to attest to A, their product did not come into contact with priority food allergens, or B, that they did come in contact and that they are revising their labeling within 6 months or the next label run. And again, the submission, it would require a notification to the Natural Health Products Director that additional risk information was being added to the label, and you would also have to submit the revised product license application, the pertinent pages, as well as the revised label text. And just the other day on December 6th, there was a consumer advisory issued about a recall of 2 separate natural health products labeled as non-dairy probiotics that were found to contain the dairy products, so they have been recalled from the marketplace. So as I say, there is an increased emphasis on natural health products and allergens. It's suggested that you view the Food Directorate's website or the CFIA, the Canadian Food Inspection Agency's website, identify the priority allergens, and ensure that your product does not contain any of those allergens. Just a note on site licensing. Again, we're currently dealing with a self-attestation. You are adhering to good manufacturing practices and comply with the site licensing requirements. This is no longer considered to be sufficient, not an adequate guarantee of the safety and quality of products. So the Natural Health Products Directorate is moving forward with an enhanced risk-based approach to site licensing, which most likely will contain an on-site third-party verification component and audit of your GMP practices. It's long been discussed in the industry and by other stakeholders the need for some type of on-site verification. So there has been there's a technical working group that is being convened. It's quite a small group, approximately 6 people, will be put together to develop a discussion paper that will then go out for stakeholder consultation. So it's anticipated that the stakeholder consultation will occur in the spring of 2011. Our Health Products Program Advisory Committee seems to meet every 3 or 4 months or so. Their last meeting was on October 4th and 5th of 2010. Program Advisory Committee is made up of stakeholders, representatives of industry associations, independent companies, consumer associations, academics, healthcare practitioner groups, etc. This group convenes and discusses current and emerging issues with the Natural Health Products Directorate and makes recommendations and offers opinions on various strategies. So the recent documents that have come out were proposed revisions to the Standards of Evidence and Testing Requirement documents. It did look like the Natural Health Products Directorate was moving forward with some of these amendments, but it since seems to have stalled. So I think the bulk of the discussion at the most recent PAC meeting was about how to get the NHPD back on track and moving forward with changes to the Standards of Evidence and Testing Requirements documents. Also decisions relating to the compliance policy, adverse reaction reporting, and as mentioned, the convening of the working group on weight loss, weight management products. So their next meeting is in January of 2011. Again, there is some information on the Natural Health Products Directorate's website, but it's very limited in terms of the PAC activities. You can access their agenda, and that's about it. Just a few additional points under communications. One, the Natural Health Products Directorate has been quite active in trying to educate stakeholders, particularly with the online solution, the electronic product license application form. They've held several webinars on how to fill out the EPLA for different application types and also how to use the submission builder. They do have one last webinar, I think, for this year, which will be tomorrow. It's on finished product specification form. There are 2 sessions, one in French and one in English. This information came out via the email system. There is an email address there for you to contact if you're interested in participating, though they did say that you should sign up by December 6th. But if you haven't signed up and you're interested, I would still give it a shot. The other topic I wanted to mention is the Food and Drugs Act Liaison Office. This office has been around since March 2008. It's to act as sort of an independent body to intervene or aid in disputes between stakeholders and various government departments. So it was created to increase openness and transparency between government departments and stakeholders. They have been intervening in some issues with, for example, companies bringing a product across the border and it's been held by Canada Border Services Agency, or companies that have challenges with the Natural Products Directorate in the review of their applications, or companies that have had products subject to recalls. So you can report on their activities and their success rate and what they've actually accomplished over the last 2 years. It is on the website at the link there. To give some examples of how they've been successful in their interventions between stakeholders and government departments. So it's a short summary, but it makes for interesting reading. Again, if you do have challenges with government departments, the Food and Drugs Liaison Office is there to help you I think there's only a couple of people in the office, but it's worth a try if you're having challenges. The last comment is with regards to the BEEP. Again, this is the Natural Health Products Directorate electronic email service. A lot of communications, if not the majority of communications between NHPD and stakeholders, come out via the BEEP email system long before they're posted on the website. So a lot of information I've given you today, again, you won't find it on the website. It has come out via the BEEP email system. So if you're not on it, again, I strongly suggest that you go to the link there and sign up for it. Just in summary, in terms of moving ahead, it's amazing how fast things can change and how much is changing. I was surprised to find all the things that had happened in the last few months. Again, when we look at the licensing statistics, the number of applications that are being refused at the outset, the number of applications that are in hold within the Natural Health Products Directorate, and the actual licensing rate, the success rate of getting an actual product license, it speaks to the need to clearly understand the requirements for getting quality, complete applications to the Natural Health Products Directorate. As we move towards the full implementation of the Compliance Enforcement Policy date of March 2011, it's imperative that we submit these complete high-quality applications in order to get our natural product numbers, or DIN-HMs. We also have to be aware, if you want to get the exemption number, that it's up to you to identify your products and opt into the system. The government won't come knocking on your door and telling you that you only have 60 days left to apply for an exemption number. So again, it's imperative come March 2011 that you have an exemption number or a natural product number, and that you're dealing with a valid site license holder for the manufacturing, packaging, and labeling of all your natural health products. If you need any help, Dicentra is here. We can help you again from concept to shelf. So thank you very much for your attendance. Please complete the survey, and season's greetings to everyone. Hopefully we will see you in the new year. Our next webinar is scheduled for Wednesday, March the 23rd, 2011. Thank you very much.